Welcome back to Trend Tuesdays with AngelouEconomics. My name is William Mellor, and today we're going to talk about news on the healthcare front. So just recently, the Koch brothers released findings of a study that they funded for the purpose of showing what the economic impact or the fiscal impact will be of a single-payer healthcare system in the United States. That system is also known as Medicare for All. And the findings show that the price tag for that will be $32.6 trillion over the next 10 years. The 10 years being 2022 through 2031. Now that is a significant sum of money, and the report mentions that even if you double the federal and corporate income rates, you still wouldn't cover that amount of money that needs to be put into taxes in order to fund a single-payer healthcare system. Although it is worth noting that in 2016, we actually spent about $3.3 trillion on healthcare. And if you project that over the next 10 years, that's $33 trillion. So the amount of spending is roughly the same. It's just a matter of who that spending is going to, whether it's going to private insurers or whether it's going to go to the federal government. But there's a far more interesting statistic to come out of that study, and it shows that national personal health care costs decreased by about 2%, and total healthcare expenditures decreased by about 4%. Now, over a 10-year period, that comes to savings of about $2 trillion. Now, you're probably thinking, wait a second, this study that was supposed to be funded in order to show or discredit a single-payer healthcare system now shows that instead there's savings associated with this that outweigh the costs? And the answer is yes. Even once they factor in things like increased demand for healthcare services from having no copay, from adding categories of benefits, and from covering the currently uninsured. The study does show and even argues that a single-payer healthcare system can add more access to more people at less cost. So again, the difference is who is receiving that money, or to whom are you making payments? Are you making payments to private insurers, or are you making payments to the federal government, who will then administer this healthcare system? And that's a point where reasonable people can disagree. And any economist or any researcher worth their salt is going to tell you that this is just one study, and if you really want to understand the bigger and more comprehensive impact of a single-payer healthcare system or of any healthcare system, more research needs to be done. But one thing's for certain, it's that the Koch brothers didn't intend to give talking points to democratic socialists for the next 2 years. Well, that's Trend Tuesday. Thanks for watching, and we'll see you next Tuesday.